My name is Nelson Lopez. I'm born February 27, 1955.
Very good. Thank you for just verifying that. So, what
The
you're here
benefit
for
of
today
postural
is to help
drainage
with
allows gravity to assist with
secretions
draining
going on
secretions
in your
from
blood
each of the
system,
patient's lung
okay? So
segments.
in your right upper lobe,
Priority should be
we're going
given
to
to treating the
create
most
this
affected lung
postural
segments first.
positioning.
The
And this is
patient is
going to
going to be
be
encouraged to
just to
take deep
help
breaths
you
in the
try and
postural
speed
drainage
up some of
positions,
that
coughing
secretions,
in
okay?
between the
Because this is that
positions
area
as the
where the
secretions
hopefully gravity should be
mobilized.
pushing out. So with this, you're just
Looking
going to
at the
take your
patient's
glasses off
position,
and you're
the
going to keep your head
segmental
on the
bronchus
pillow
is
as such if you
arranged
are
in
at
a
home.
position
Just
that
go
is
ahead and keep
perpendicular to
turning
the
to the
floor.
right. Good, your arms are in a perfect position. And
Here,
here's a
postural
bag.
drainage
So
is used
whenever you're coughing, you just go
exclusively.
ahead and cough up into
The
that.
patient will be
Okay?
maintaining this
Are
position
you
for
comfortable?
5 to 10 minutes
Very
or
good.
longer if tolerated. Here, the patient is being put in a position to affect the posterior apical segment of the right upper lobe.
Go ahead. I'm just going to
It's
encourage
important
you to
to always
breathe. And I'm
look
going
at the
to.
patient's face throughout this postural drainage position, looking for signs of intolerance, including increased shortness of breath, anxiety, nausea, dizziness, hypertension, and bronchospasm.
Next lesson, we're going to go ahead and teach you something called diaphragmatic breathing. So for the recording, we have you in the supine position with a pillow underneath your legs before
A
you start.
specific breathing
And then
strategy
complete
that can be
down
taught to
your seat
patients for their
So with
dyspnea,
this,
reduce
we're going to go ahead
alactasis,
and
and
you're going
increase
to upper belly,
oxygenations for
your arms,
efficiency
your
and
left arm
ventilation
straight to your
is
right.
called
Very good.
diaphragmatic
Now
controlled
we're dropping
breathing.
your arms. So keep your thumbs
Essentially,
on
the
your
outward
abs and
motion of the
glutes.
abdominal wall
That way you're
helps
able to
reduce
lift
the
your chest
upper
up.
ribs
And I want you to go
during
ahead and do this.
inspiration.
I want you to practice taking breaths. And I want you to try and have the primary arm under your lead arm with your stomach to be the one that's moving. I want you to try and concentrate on breathing from the top of your arms and not be coming from the top of your chest, okay? So I want you to go ahead and take a deep inhale, try to inhale, and try to make your tummy rise, and then you're going to take a deep exhale through your mouth. Let's go ahead and practice
When
that together.
first teaching this to
So breathe,
patients,
breathe, breathe,
it's
breathe. Keep your
often
arms on
easiest
your
for the
stomach,
patient
and
to
you have your
achieve the
glass off. So
diaphragmatic breathing
let's
while
see.
they're
We're going to
in
teach you
the
how to keep your eyes
semi-fowler
open, and you're going to
position.
look at the rise of
But
your stomach.
the
Look right
position
there,
that the
right there.
patient is
Let's go ahead.
currently is supine, which is still a good position to be taught. Then, while the patient masters this breathing technique, they can attempt it in a
Good.
seated, a
Inhale through your
standing,
nose,
or
watch
any
your
type of
abdomen.
activity.
Exhale through your mouth and watch it go low. Try and keep this hand at that same position. Don't have that rise. Make all your rising coming from your belly. Very good. Good, good, good. Continue, please. Continue. This looks very good, Nelson. Continue. See the rise. Deep inhale through your nose. Watch the rise of the hand. And then go ahead and exhale. Very good. Any issues? Good.
Postural drainage may be used exclusively, as seen previously, or in combination with other airway clearing techniques. The clinical approach to adding the airway clearance techniques, such as percussion and vibration, during the postural drainage includes a re-examination and utilization of the techniques until the secretion is clear. So there's no specific timing that the patient is supposed to be here. We want to see that there's an actual change in the secretions. A therapist would want to use chest percussions if they have an aim to want to loosen up any retained secretions in the lobes. This postural drainage position allows for gravity to assist with drainage in the right upper lobe. Manual percussions consists of a rhythmic clapping with cupped hands over the affected lung segments of the patients. Air is trapped between these cupped hands positions and the patient's chest with each clap. The hollow thumping sounds should be produced. If a slapping sound is produced, this indicates that the technique is done incorrectly. Before initiating the percussion technique on the patient, the therapist needs to consider their own positioning. This can help reduce any fatigue that can cause the technique to be done incorrectly, and this can help reduce any strain on the therapist due to being in that position for a certain amount of time. Once the therapist has chosen their proper positioning, their hands are cupped with the fingers and thumbs adducted. The hands are clapped over the thorax while the wrists and elbows remain relaxed. The hands essentially fall on the chest in evenly steady rhythm between 100 and 480 times per minute.
So I encourage you, we're going to start
The percussion technique should be avoided over bony prominences, such as the spinous process of the vertebrae and the clavicles, and most definitely should not be done over surgical incisions and medical appliances.
For this last test that we're going to go ahead and do for you, we're going to go ahead and do the anterior compression, okay? And with that, your arms are going to be by your side. We have the trash bag still right next to you, so you can go
The
ahead
final
and
technique that's done for the patient is called the anterior chest compression assisted cough technique. The patient is supine, and then the therapist places their forearm, one on the upper chest and then the other one slightly distal to that. The patient is instructed to inspire. At that time, the therapist then puts quick bouts of resistance. This helps the patient in facilitating a deeper inspiration. Then the therapist instructs the patient to hold that breath. From there, they are told to turn their head in a sideways, opposite from the the therapist, and they are told to cough. The therapist then assists the patient during this cough by applying that downward force through their forearms.
Okay, we're going to do this with one more time, okay? So we're going to take a deep inhale. Give me some resistance. Hold the breath. Turn your head to the right and release. And try and get a nice big on. Not so much pursed lips. Go ahead and look up again one last time. Try and get like a big out, okay? So in the positioning, go ahead and remember to take those deep inhales. Hold the breath, turn your head, and go. Very good, and go ahead and come back up.